Hi, my name is Amy Cooper. Today I'm going to be providing some pain management education for new mothers postpartum. So the first thing that we're going to talk about is the medications. So your doctor may or may not have provided a prescription for a narcotic pain medication. This could be something like Percocet or codeine, anything to help manage the pain. These are mostly given if people have had episiotomies with stitches that's going to require some healing time, or C-sections, cesarean sections. Also, they may be prescribed if your pain is not being controlled with lower doses of medications such as Motrin or Tylenol, or if there's an allergy to Motrin or Tylenol, these alternatives can be used. So the biggest thing, if you are being given prescription narcotic medications, is take as directed. Do not take more than is directed by your doctor. Ensure that you are taking them with a small snack and plenty of water. The biggest side effect of these medications that's going to be most important to mothers is it can cause constipation. And the biggest thing, one large thing after birth, is that it can be extremely hard and painful to have your first bowel movement. So ensuring that you're taking lots of water, even possibly a stool softener for the first week or two, may be beneficial. But if you did not go home with prescription pain medicine, it is okay to be using over-the-counter Tylenol or Motrin. Motrin would be the number one over-the-counter medication to be using, but if you cannot take Motrin for whatever reason, Tylenol is acceptable as well. Just remember, again, lots of fluids. You're going to need lots of fluids anyway if you're going to be breastfeeding, but also if you're taking Motrin, ensure that you are taking it with a little bit of food, even just a small snack, because sometimes Motrin can be known to upset your stomach and irritate your GI tract. Again, take as prescribed, either medication. So other things that may be happening is you may be having some after pains. These pains can actually last up to 10 days, which can be uncomfortable. Ways that you can help with that is simple relaxation techniques, deep breathing, things that you may or may not have learned before going into labor, but all the breathing, deep breaths in your nose and out your mouth. Exhale all the way. Do those at least 10 times, or even up to 1 to 2 minutes. Can just kind of help relax your whole body and even reset your mind. Other things that you can do, frequent breastfeeding is going to kind of speed that process along. The after pains are going to come from your uterus trying to contract back to its original position. So that's what that cramping and that maybe aching source feeling that you are getting. It can be uncomfortable. Another thing with that increased fluids that you're going to be taking in, and make sure you keep your bladder empty so it's not going to be expanding and pushing on that uterus as well. And doing some light activity. We know you're tired, mamas, but you got to get up and start walking around. All that's going to help make you feel better. Now, if you've had a laceration, a tear, an episiotomy, these are extra little things that you can and should be doing. So make sure you're washing your hands really good before and after you go to the bathroom. Ice packs can be very helpful. They're most helpful within the first 24 hours, but they can be continued at home. You may be provided with some ice pack peri pads. With those, it's a simple little twist till it pops and kind of shake them up, and they can go right in your underwear. You may still need to use a peri pad in addition, because there's just a very thin layer on top of these ice packs. But they can be very helpful for swelling and pain and discomfort. Also, when you're going to the bathroom, make sure that you're using a peri bottle filled with clean, warm water. You just kind of squirt top to bottom, just like we wipe ladies. Kind of let the water flow over any stitches or tear, and then pat dry with a clean towel. let's see, you may also make a witch hazel compress, which is also helpful for any discomfort that you may be having. There are topical sprays available. If you feel like none of this is really helping, you can get a over-the-counter topical spray, kind of just spray the area that's bothering you the most, may provide some relief. So after the first 12 hours after you've given birth, it's okay to do a sitz bath. These are most helpful for patients that have a tear, episiotomy, or even from hemorrhoids that may have arisen during the pregnancy and especially during labor. This is all, a sitz bath can be all comforting to that. So you may have been provided with a sitz bath tub that can sit right on the toilet, but if you have not, the easiest and next best thing to do is in a clean bathtub, just fill it up with a few inches of warm water and go ahead and have a seat in that. Just soak 15-20 minutes, a couple times a day, once a day, whatever you feel comfortable with, but just having that warm water, A, cleans the area, and B, can just provide some comfort, help with the swelling, help with the irritation, and it gives you 20 minutes away, hopefully baby free, and you can do some deep breathing exercises as well. All right, so that's all my pain management teaching and techniques that you can use. If you have any questions, don't hesitate to ask your nurse. Don't hesitate to give the hospital or your doctor a call. We want you to be successful, have the least amount of pain tolerable, and enjoy that new little baby. Have a great day.